The Emergency Department Prevention Quality Indicators, or ED PQIs, have been incorporated into AHRQ's quality indicator software, and the new module is awaiting beta testing. This presentation will orient potential users by describing the measures and their objectives, how they were developed, their specifications, and how to calculate them using public software. It will conclude by explaining the kind of feedback AHRQ hopes beta testers will provide. The Emergency Department PQIs are indicators of avoidable healthcare use occurring in the emergency department. The version 2023 beta software was derived using 2019 HCUP data to form a reference population. The reference population data is used to calculate the measures and to estimate parameters for risk adjustment, as well as national benchmarks. As it conducts beta tests, AHRQ is also reviewing and refining specifications for the ED PQIs. To access documentation, specifications, and software, you can find them on AHRQ's Quality Indicator website. The ED PQIs add a new feature to the quality indicators by extending them to include a new dimension of avoidable care, care beginning and ending in the emergency department. The measures include any patient with qualifying conditions that comes through the emergency department, so they overlap with the inpatient quality indicators, which also include stays coming through the emergency department, but they add to the indicators a completely new source of information, the treat and release visits to the emergency department. Also, one measure for back pain requires an additional capability of the HCUP reference data used to establish parameters for the quality indicator software, or for any other data source used to calculate the measure, which is the ability to detect when patients have multiple visits, since that measure is based on patients being treated more than once in the emergency department in the same year for back pain. The emergency department PQIs are included in a new software module similar to the inpatient area quality indicators, the PQIs, and the area pediatric quality indicators. They have three-letter labels like the other modules. Software for the ED PQI uses the prefix PQE to indicate that they are similar to PQIs, but for avoidable ED visits. This slide shows how PQEs fit into the set of AHRQ's population-based quality indicators, how they compare to the two inpatient modules. First, PQIs concern avoidable admission for adults. PDIs concern children's admissions, while PQEs concern both children's and adults, depending on the measure. PQIs include 10 individual measures, which are also combined into 4 composites, while PDIs include 4 individual measures and 3 composites. The PQEs are essentially 3 indicators based on individual conditions, PQEs 1, 4, and 5, and 2 composites, PQEs 2 and 3. But the PQEs for individual conditions and the composites don't overlap. The PQEs include adult and chronic composites, just as the PQIs and PDIs contain acute and chronic composites. PQE2, visits for chronic ambulatory care sensitive conditions, includes diabetic complications and heart failure, like the PQI chronic composite, diabetes PQI composite, and individual measures for diabetic complications and heart failure. However, PQE3, visits for acute ambulatory care sensitive conditions, includes different conditions than either the acute PQI composite or individual acute PQIs or acute PDIs. PQE4, the asthma measure, overlaps with PQI 15, asthma in young adults, and with the asthma PDI, PDI 14. The PQEs also include dental and back pain measures, PQEs 1 and 5, that are unlike anything in either of the inpatient modules. The ED PQIs were developed between 2010 and 2013 as a suite of indicators intended for use with other AHRQ quality indicators. They were selected and specified based on input from an environmental scan and in consultation with clinical and coding experts. They measure health system performance and the role of community health in preventing emergency department visits. The rationale for extending the quality indicators to include emergency department use is to provide a more complete picture of avoidable healthcare than what is represented by looking only at inpatient admissions. It extends to both the additional setting and to additional conditions that are more likely to result in emergency department visits than in inpatient care. The conditions included in the ED PQIs were selected by reviewing scholarly and gray literature to identify conditions suspected of association with emergency department overuse or avoidable emergency department visits. They were prioritized by a working group including emergency department and community physicians. Specifications for the highest priority conditions were extracted from published specifications, including specifications for the PQIs and area PDIs in ICD-9-CM, which was the standard for coding diagnoses in the US at the time these measures were developed. Using AHRQ's data from the period 2008 to 2010, linked with the Area Health Resource File and American Community Survey, an empirical review and validation were conducted by assessing the relation of the ED PQIs to community predictors of ambulatory care quality. These results were reviewed in turn and measure specifications refined and completed by a panel of clinicians and end users using a modified Delphi technique. Results were published in the peer-reviewed literature, with the citation appearing at the bottom of the slide. For version 2023, these specifications were converted from ICD-9-CM to ICD-10-CM using a combination of automated code translation and review by clinicians and coding experts, and by comparison with PQI and PDI specifications. They were updated for coding changes through fiscal year 2023. The software for the measures was then updated, creating modules harmonized with other area QI software with similar risk adjustment and reliability adjustment options. The ED PQI's updated technical specifications were incorporated in documentation similar to other modules and prepared for publication. And risk adjustment parameters and benchmarks were estimated using the 2019 AHRQ. The PQA specifications overlap with both PQI and PDI specifications because they include visits for both adults and children. The dental condition PQE, PQE1, includes emergency department visits for non-traumatic dental conditions like caries, gum disease, mouth pain from unspecified conditions for children aged 5 and over and for adults. The chronic conditions PQE, PQE2, is restricted to adults aged 40 and over. It includes visits for asthma, COPD, diabetic complications, kidney disease, and heart failure. The acute conditions PQE, PQE3, includes visits of children aged 3 months and above and adults up through age 64 for flu and upper respiratory infection, cellulitis pyoderma and skin infections, and cystitis among young women. The asthma PQE, PQE4, is restricted to children 5 and above and adults under age 40 and include visits for a first listed diagnosis of asthma or for a first listed diagnosis of bronchitis with any mention of asthma. And the back pain PQE, PQE5, is for patients 18 and older with at least 2 emergency department visits for back pain during the 12-month numerator period. To calculate the measures, you'll need to input your population's hospital data, selecting emergency department stays based on revenue codes or CPT codes. This selection matches the AHRQ data used to develop the indicators. For PQEs 1, 2, 4, and 5, the logic includes all emergency department visits, both treat and release emergency department visits from the state emergency department data, and inpatient stays beginning in the emergency department from the state inpatient databases. For PQE3, visits for acute ambulatory care sensitive conditions, it includes only treat and release visits from the SED. A population denominator is provided in the software. To use a different denominator, the software must be modified. The denominator included with the software and used to develop risk adjustment parameters is census data at the county level. Users can select a risk adjustment method. Similar to PQIs and area PDIs, 2 risk adjustment options are offered: age and sex, and poverty. Reliability adjustment is also included. To conclude, AHRQ is conducting a beta test of version 2023 ED PQIs and hopes that testers will provide AHRQ with feedback that will improve the measures and users' experience. Feedback subjects would include users' perception of the value or validity of measuring healthcare overuse in the emergency department in general, and of the measures in the module in particular. Potential refinements to the measure specifications or questions about how measures are specified. Potential uses for the PQIs envisioned by their users, including their sources of input data. Comments about or suggested changes to documentation. Comments about or suggested changes to the software. Input about terminology used to name the modules or labels used in the software. Users can share their feedback by emailing to the address shown, QIsupport@ahrq.hhs.gov. If you have any questions about the beta test or the module, please contact tech support at QIsupport@ahrq.hhs.gov. Finally, AHRQ would like to acknowledge support of its partners in contributing to the state emergency department data and state inpatient databases.